If you have diabetes type 1 and you are on insulin or type 2 diabetes and you require insulin or medication that lowers your blood sugar levels, it is more than likely that you are doing the finger prick test, also known as BM. Now, the finger prick test involves using a small needle called a lancet to draw blood from your finger to use on a test strip. Finger prick test can be a hassle for many as it's painful, you need to use needles, and it's basically a process. You need to take out the lancet, find a quiet place, prick your finger, put the blood on a test strip, then make sure the glucose meter is working. So if you're not keen on using the finger prick test, you can now check your blood sugar levels using either the continuous glucose monitor or flash glucose monitor. These devices allow you to use a sensor which is usually applied to the arm, and the sensor then sends blood sugar readings to the receiver via Bluetooth, which might be an app on your smartphone or small device known as the reader. The sensor is disposable and has to be replaced every 7 to 14 days and can be worn for any occasion during shower or playing sports. Note that they cannot be taken off anytime, and if they do fall off, then you have to use a new sensor, so you can apply adhesive tape to prevent that. So let's look at the continuous glucose monitor known as CGM. With this CGM, the sensor is usually applied to the underside of the arm or belly and sends blood sugar readings to your smartphone or reader automatically via Bluetooth at least up to every 5 minutes or every 1 to 15 minutes, depending on the device, as some CGMs are more accurate than others. With the flash glucose monitor, the sensor is applied to the side of the arm and you have to scan your smartphone or reader over the sensor to get your blood sugar readings. So the advantage of the CGM over the flash is that you do not have to worry about remembering or physically bringing out your device to scan the sensor, and if you use an insulin pump, there are some CGMs that can send readings to the insulin pump. The advantage of the flash over CGM is that you do not have to calibrate the sensor, while with some CGMs, you need to finger prick test twice a day or every 10 hours to calibrate the sensor. The advantage of using CGM over finger prick test is that the CGM monitors your blood glucose at any time 24 hours a day, and results can be sent to your diabetes team for monitoring. You can also send data to a family member or friend to help monitor your sugar levels. You do not need to draw blood to check your blood glucose, and you can set alarms to alert you if your blood sugar levels are too high or too low. It also allows you to know how your blood sugars are doing in relation to eating, exercise, stress, so you can adjust your insulin medication accordingly. The advantage of using the finger prick test is that it gives you an accurate reading of your blood glucose in real time, while the CGM tends to lag up to 15 minutes behind the actual blood sugar readings. And this is because while the finger prick test measures the sugar levels in the capillaries, the CGM measures the sugar levels in the fluid surrounding the cells. So what this means that there will be situations that while you're using your CGM, you would still need to use your finger prick testing for more accuracy. For instance, if you work in a safety critical role such as HGV driving, rail, or police work, and you are at risk of having hypos, remember that monitoring is done not to see how high your sugar levels are, but to monitor for low blood sugars known as hypos. So this is what puts you at risk of sudden incapacitation, especially when driving. So if you use finger prick testing and you're considering changing over to CGM or flash, then speak to your diabetes team and they can provide further information on the pros and cons of each method and what the best option is for you. I hope you enjoyed this educational topic on blood sugar monitoring for diabetes.